February is Heart Month, and today we want to look at a condition that affects millions worldwide. It's called atrial fibrillation. And joining us to talk about it and the cutting-edge advancements to approach heart health, I'm happy to welcome Dr. Andrew Sherman with BayCare. He is the chief of the Department of Cardiac, Vascular, and Thoracic Surgery at St. Joseph's Hospital, which was recently named one of the nation's top 50 cardiovascular hospitals. Congratulations. Welcome to the show. How are you?
Thank you, Natalie. It's a pleasure to be here. I'm doing well.
So I got to tell you, I'm glad we're talking about this because I always hear the term, AFib thrown around. That is what we're talking about, right?
Yes, yes.
So what exactly is it?
So it is actually the most common irregular heart rhythm that exists. And it is the upper chambers of the heart, the right atrium and the left atrium, beat rapidly, but not in coordination with the lower chambers of the heart. So it's a disorganized, chaotic rhythm that can sometimes be fast or sometimes can be slow.
Yeah, and I'm fair to say we don't want, chaos in the heart.
No.
So let's talk symptoms, though. Obviously, we don't know what's going on inside. What are some of the symptoms that we need to take note of?
So a lot of our patients complain of sometimes a rapid heart rate or their heart racing, but it also then goes beyond that. They start to feel more fatigue, lack of energy. They can be short of breath. Sometimes exercise that they could easily do now is more difficult to do. So it really impacts their overall quality of life.
So is it one of those things like the heart's working so much that then you feel it with your body just being fatigued?
Ultimately, and then sometimes patients get so used to it, they don't even realize how fatigued they are until we get them out of atrial fibrillation.
Okay, well, if they don't necessarily notice the symptoms, let's talk about some of those long-term consequences.
That's a great question and a very impactful thing that a lot of our societies are looking at, because we treat high blood pressure, we treat hypercholesterolemia, we treat diabetes like a disease or a condition, and atrial fibrillation has sort of been left alone, but it has some very bad outcomes if we leave it alone. Decreased life expectancy, increased risk of heart failure, increased risk of stroke, and even some more recent studies that have talked about cognitive decline.
Those are some obvious big ones. I mean, we're talking life or death situation here. And I'm curious, though, and why we're so happy you're with us. We now get to talk about the advancements, though, in care. What is happening at BayCare that you can share with us today?
Absolutely. So, two forms of atrial fibrillation we see commonly. We see patients who have atrial fibrillation who are not otherwise going to be in an operating room. So, standalone atrial fibrillation, we see patients. And over the last decade and a half, one of my esteemed colleagues, Dr. Kevin McCarty, who's an electrophysiologist, he's sort of the cardiology side of the atrial fibrillation, and I'm the surgery side of it. We've helped develop a procedure where we work as a team. We work collaborating together, where I do a portion through minimally invasive incisions and ablate outside the heart, and then he, at a later time, comes in, makes sure I got to everywhere I needed to get to, and he ablates from the inside of the heart. And with that procedure that we've been developing and innovating and changing over the last 10, 15 years, we're now on what's called the Convergent 3.0. So that's something that we offer to all of our patients who have many of our patients who have atrial fibrillation who are not going to be in an operating room. Now, the other side of it is patients that I see commonly who are coming to my operating room for other reasons. They're there for bypass surgery, they're there for valve surgery, and they're afflicted with atrial fibrillation. It's an incredible opportunity for me to address their atrial fibrillation. It would be a big missed opportunity if I didn't also address their atrial fibrillation at the time of their other cardiac surgery. So what we've come up with over the last couple years now is a very novel iteration to an ablation that we've done surgically that's been very complicated. We've done it for years, but it's been complicated, and we've sort of simplified it a little bit and changed it a little bit to try to make it more reproducible for many surgeons across the country. And it's really starting to take off across the country. And it has a name, it's called the Tampa 2, which stands for a variety of different things. It's two physicians, Dr. McCarty and myself, who came up with this. Two specialties coming together and collaborating and working on this new lesion set. And then it's a nice shout out and homage to the Tampa Bay Buccaneers, because as you know, St. Joseph's Hospital sits right across the street from the Buccaneers Training Center and Raymond James Stadium. So the Tampa 2 defense has contributed to the Tampa Bay Buccaneers winning the Super Bowl in 2003. So it's a little cute thing that we've put to it.
Good for you. Well, good for you, and to be able to use your research and time and to make everyone and patients' lives better. Great to meet you. We want to make sure and share the website if you want to learn more, BayCare.org.